The first milk that your body produces is called colostrum. Your body starts making this around 16 weeks of pregnancy and continues through the first few days after delivery. Colostrum comes in very small volumes and has numerous health benefits to baby, such as immunity and coating the newborn's gut. Even though colostrum comes in very small volumes, that is enough for a full-term healthy infant. They have very small stomachs.
Baby's stomach at birth is about the size of this little green dot here, so very little.
Breast milk provides both immediate and lifelong immunity for infants.
Breastfeeding not only benefits the baby, but also benefits the lactating parent. So someone that breastfeeds actually has reduced risk of breast cancer later on in life, as well as ovarian cancer, reduced risk of cardiovascular diseases, and reduced risk of type 2 diabetes. It takes about 3 to 5 days for milk to come in. That's why we encourage frequent breast stimulation via breastfeeding, hand expression, or pumping. It depends on the situation, but frequent breast stimulation, getting that colostrum out, is what helps tell the body to transition to mature breast milk.
The most important factor in creating and building a full milk supply is frequent stimulation, especially in the first 2 weeks. By responding to your newborn's early feeding cues, your body will produce exactly the amount of milk that your infant needs. Early feeding cues include rutting, licking of their lips, sticking out their tongue, and hand-to-mouth activity. Crying is the last hunger cue.
So typically babies are more awake during the first few hours after birth, and then they can become pretty sleepy. During the first 24 hours, it's important to do lots of skin to skin, and if baby's too sleepy to latch, lots of hand expression. It's important to offer the breast to the baby at least every 2 to 3 hours and on demand if baby's requesting it.
A good breastfeeding session lasts 10 to 20 minutes. Breast should feel softer afterwards, and you should hear your baby swallowing throughout the feeding. Signs that your baby is getting enough milk are that they will be content after breastfeeding session, falling asleep, or relaxed body language, adequate number of wet and dirty diapers, so 6 to 8 in a 24-hour period, and appropriate weight gain.
Here in the hospital, you always have access to a lactation consultant. Your postpartum nurses are great resources. After discharge, we have the breastfeeding helpline, and we also have the outpatient lactation clinic that we'd be more than happy to see you at.
As lactation consultants, we're here to support your family's feeding goals, no matter what they may be.
Feeding options for a baby can include breastfeeding, chest feeding, formula feeding, pumping and bottle feeding, or a combination of all of those.